Amazing.
Yeah.
Sounds great. Well, welcome to another episode of The Ripple Effect with Ray. I have Kerstin and Helen here. They're the co-founders of Peli Health, and I'm excited to dive into all things pelvic floor health today. So thanks for being here.
Thanks for
Thanks.
having us.
Thanks for having us.
Absolutely. So if one of you would like to start us off here today, how and why did you get, it's a very niche sector of health and wellness, right? So how and why did you get started with Peli Health?
Yeah,
Yes.
I'll jump right in. And Helen and I both have slightly different stories. We're two women and two different parts of the country, different ages and stages of life. But we've known each other for a long time. We've worked together professionally. And over the years, you develop a friendship. And we were talking over the phone. I had my son via emergency C-section. And afterwards, I experienced excruciating pelvic pain. No one prepared me for it. No one talked to me about it. Post C-section, as I was going through that months later, I went to 4 different doctors, one of which told me, oh, you're a new mom, you're just stressed out, relax and have a glass of wine, which is not fixing nor addressing the problem. That's called medical gaslighting. Unfortunately, it still happens. I'm a very bullheaded person, and so that was not going to work for me. And I continued on my journey. At about 9 months, I found my way to a pelvic PT. I'm lucky enough to live near a specialist here in I live in Miami, and it changed my life. I went through 4 months of intensive pelvic floor PT. I was lucky enough I had a job that I could be flexible and I could go do that. I did that for 4 months. And I think what really, for me, it opened my eyes as, the more I learned is my situation could have likely been prevented had I had education earlier and information earlier and access to guidance and care earlier. I'm also from the Midwest originally, and the whole time I'm sitting in a urban area, I'm thinking about my family and many other, in our case, Americans that live in rural areas or suburban areas that don't have access to specialists and care. And so, like many things health related, accessibility and affordability really became the drivers of Peli Health. But in my conversation with Helen, it also uncovered some other things. So mine was at my postpartum journey. And I think that's often where pelvic health gets stereotyped, where, oh, it only happens to women who have kids. That's not true. In fact, 1 in 3 women will suffer from pelvic floor dysfunction at some point in their life. Yes, if you have children, you're more likely to suffer from a pelvic health condition, but we see athletes in their teens, in their 20s, having issues with incontinence and pelvic pain, vaginismus, and we can go on, 30s, 40s. I'll let Helen talk about the perimenopause menopause journey, which is also where these things can rear their head. So Helen, do you want to share your journey, your why?
Yeah, sure. And yeah, it was a continuation of that conversation that Kirsten and I had, feels like way back when now, and once her son was born, and we were talking about this over a Zoom call and chatting about it and realizing it was just an area of women's health that I think doesn't get enough attention. And I'm older than Kirsten, so I was in the perimenopause phase of life. And with that comes a whole long list of different symptoms and things that you might experience. And within that is changes to your pelvic health. No one has ever brought that up, I think, prior. I've never heard that amplified on a big stage. But now we're having the conversation about menopause, which is really encouraging. And, we love hearing more and more about menopause getting a spotlight. But part of that is your pelvic health, and your pelvic health, as Kirsten said, change from all different stages of your life, from when you're a young teenager right the way through into post-menopause. And no one was really amplifying that. And so for me, when things started to change, when your estrogen declines, when your hormones are shifting, that's when you can start to feel some changes to your pelvic health. And the conversations I was having with my friends as well, the changes and the struggles they were having, maybe it was leaking, maybe there was pelvic pain, maybe there was dryness. No one talking about this, and it was often really heavily stigmatized as well. So one of the things that we saw, and slightly a challenge, I guess, with discussing pelvic health, is the stigma, is that there are a lot of women who still feel embarrassed to talk about it. It's just health. It's just a part of your body. It's a really crucial part of your body, and it's holding a lot of things together. So it's about time we really started to talk about it. And I think for us coming together, seeing that it was not just an issue for, as Kirsten said, if you've had a baby, postpartum, but also different stages of your life, we felt that really it was time to start changing that narrative and looking at what we could do collectively from our experience in the past, our previous work life, how we could utilize those skills and bring something a bit more fit for purpose for women's health today.
Absolutely. Well, I think that's such an important topic and important area to be focused on because it isn't talked about enough. And there's that stigma that you mentioned of like, oh, it's not something that we can visually see, and it's something that we always are trying to like keep hidden.
Yeah.
And so as far as like the education that you're trying to provide or even trends that you're seeing in the industry, how are you addressing some of those issues? How are you removing that stigma around pelvic health?
Yeah. Do you want me to jump in, Helen?
Yeah, sure.
Okay. I think that's a great question. I think with education, well, with pelvic health, one thing that we realized early on in the journey of this company, I think Helen and I both had an idea of what we were thinking about building, like many founder journeys. But given our backgrounds, the first step was let's go talk to people. And when I say people, women and practitioners. And so we surveyed 400 women between the US and the UK, and thus began our focus on education. And because what the conclusions were we started with the question, do you even know what pelvic health is? Most people don't. So what is pelvic health, right? You have to start there. So for that, it's, when you think about your pelvic floor, it's responsible for your daily bowel function. It's responsible for your sexual function. It's responsible for stability. It's responsible for holding all your parts inside, like a little hammock. But we don't talk about it. So if we don't know its purpose in our body, we can't then think about why it's important. And so the education part became really critical. So that's on the patient side. On the physician side, and when we say physician, MD, but also pelvic PTs, what we kept hearing from them is, I don't have enough time to spend educating. It's just the way our system is built, our health system, and I'm speaking from the American side. The way our health system is built is there's less and less time to spend with each patient. And but these physicians and these PTs know, if my patients get access to education, we know that their outcomes are better. And in fact, there's studies that show patient education, for every dollar spent, there's a $14 return in savings in outcomes, which means education leads to better outcomes. I always like to look at, on a kind of a parallel but different, right? When we think about breast cancer awareness, right? If you go back a few decades, the self-exam was like not a thing, but we had to push it. So because we needed to understand that earlier detection, at home detection, could lead to better outcomes. Now, I'm not saying you're going to get cancer if you don't pay attention with your pelvic floor, but it's the same type of situation. The more we know about our bodies, the more we can improve our health. And so when we took our approach to education, to answer your question about destigmatization, part of it is education, but how do you do that in a way that resonates with people? And when we looked in the market, there's a lot of very scientific things in the market, research papers being written. And unfortunately, it's a topic that's very intimate for women. And so sometimes that scientific jargon feels like a whole nother language. And that alone is intimidating. And the moment you meet that, what we heard from women in our surveys, they kind of just shut down. Like, I don't understand it. I don't get it. So I'm going to kind of stop there. And Helen and I saw an opportunity. I think given our backgrounds, I spent a lot of time in media and entertainment earlier on in my career, that, well, how do you make this tangible and a topic that can be a little bit more playful? How do we infuse wit and humor, but in a way to destigmatize, put down that barrier, still say the scientific thing, but then break it down and be like, girl, this is what's really going on with your body. And so we developed this persona of the brand that was like, Well, if Helen and I had a best friend that was like super, super smart and she went to medical school, but is like witty and funny like a comedian, that would be someone I'd want to talk to about this, right? That can make me feel comfortable, but in a way, in a language I get. And so that's been one of our things from the very beginning, right? Grounded in evidence, grounded in science, but written in a way that, like, if you're at a table with your girlfriends on a brunch, you can talk about it and it doesn't feel cold and it doesn't feel shameful. It just is like, yeah, I'm peeing my pants. And we can tell a joke about that. And we can all talk about it as part of life, not as this thing that we hide and run from. I don't know if you have anything else.
Yeah, and I think, it is about the more we talk about things, the less stigmatized they become, a bit more. It is just health. It's another part of your body, as I mentioned. And I think also we are starting to see more in terms of industry trends of focus on prevention and preventative medicine. I think, everyone's waking up to the fact that it's probably more cost effective and it's certainly a lot more comfortable for people to be proactive about their health than reactive to their health. And so that's definitely a big shift that we're seeing. Longevity is also another thing that is really playing a lot on, and in terms of not just in industry, but on people's minds, right? We're all living longer, working longer, needing to support our families for longer. So how do we do that in a way that we are feeling that we're in our best shape, I guess, and I think that's really important. Where we used to see, especially in women's health, a lot of issues would be occurring around midlife. Well, midlife is coming later for a lot of women now, so we need to figure out how to stay healthier and fitter for longer. And so I think there are a couple of the shifts that we are seeing, and from our perspective with Peli Health is to really push that agenda among women as a direct to consumer, among women, but also within working with B2B in terms of looking at how we work with clinicians, how we work with practices, about providing that information that's really easy. They can refer their patients to it. It's something they can access at home at any given time. So whether you're busy on a different time zone, or if you're looking after children, or if you're at work, or whatever it may be, you can access this at a time that's convenient for you and on the go. You can listen to a lot of the resources we have. You can watch them, you can read them. So, but and everything is medically and clinically approved. So we know that we're not just, and that's another issue, I think, is that there's a lot of content, shall we say, that's not necessarily validated and verified. And I think that's a big issue. I know, even for myself, if I'm wanting, we're all expected to become experts on our own bodies all overnight, but I need to know that what I'm reading or what I'm listening to is actually medically verified and it's not just something that's been made up.
Absolutely. I think that's such a good point that you make is that, like, I mean, with the rise of AI and ChatGPT, like, I know a lot of us refer to Dr. Chat for
Yeah.
some of our information, and we realize too, while it has its place, you can't fully, it even tells you that it's not like, hey, you should probably reach out to a doctor regardless. Like this is
Yeah.
not medically backed. So it is really important that, they have, people who are, whether or not they're aware or women are aware of what they're seeking or what they need. I think it's really important that you say like, hey, this is all medically backed, this is all scientifically backed, and that, even clinicians are referring you out to some of their patients. And so I think it's a really great point to elevate. And so what would you say has been maybe working well? What's been a little bit more frustrating when it comes to launching the business or anything in that regard?
How long have you got?
The life of an
Yeah.
entrepreneur, I know.
Well, I'll leave those bits to Kirsten because it is, yeah, I mean, it's definitely a very different life to working for someone else. That's a challenge in itself. But I think also working in health space, constantly having to navigate a system that wasn't built around women or for women to include women, and that's been a huge challenge. Getting research that validates your outcomes, etc., that's a challenge. And this is not to sort of put up some big sort of women's right argument, but it is a fact that women weren't included in clinical trials until 1993. And so any historical information we have has been based around the male anatomy. And of course, we're very, very different. We have hormones that are very different. So I think that has been a huge, huge challenge across the board, not just for us, but across the board for anyone who's working in women's health. It is now slowly changing, which is great, but it is like moving an oil tanker. It's very slow, but we're getting there.
Yeah,
do you
no,
think?
just to continue to play into that, I think, if we come at a macro level, one of the challenges, and we can get more granular about like our challenges, but I think to play off of what Helen was saying, I don't know if you've heard about the period tax, right? Like there's a lot of extras that women pay for out of their pocket because they're not being serviced in the current medical establishment in a way that meets their needs. And so that means in a lot of cases, and you could pick autoimmune, you could pick menopause, women are paying out of their pocket for solutions to some of their health challenges they're facing. So I think as an industry, I think that's one of the frustrating things in women's health, right? But at the same time, I don't think I could be more excited in women's health because the tide is rising and the tide has to turn. And right now we're on that like upswing, right? So while all those things are true, there are more solutions entering the market. There are more female scientists entering the market, going into labs, starting labs. There are more female physicians in the market than we've ever seen. They're all going to get, not all, many of them are going to get menopause certification, right? That is indicative of a change. So we're in that becoming phase. We're not where we want to be, but it's becoming. And that is really beautiful because that means that change will happen, albeit maybe slower than a lot of us that are working in this industry would like to see it. So I think that's like frustrating and excitement at the same time. From like just our journey personally starting the company, right? Like we chose to take on a topic at the time. I will say over the last 4 years, you're seeing it change. That wasn't discussed. So how do you bring a product or a brand to market in a space where it's like, shh, let's not talk about this. This doesn't exist. What's pelvic health? Isn't that the same thing as vaginal health? And like, why do I even really need to care? Well, do you care about, laughing and leaking? Do you care about saying ouch instead of wow when you're in the middle of an intimate moment? I think we all do. But how do you talk to people? So that's a really big challenge on a brand. Well, we found this blue ocean. We always talk about the blue ocean theory. And I think pelvic health is in a blue ocean territory. It's also really challenging. So how do you bring that to the consumer? How do you talk to the consumer? How do you get them to care? How do you get them to understand the impact it has in their lives? So I think we're doing a lot of that work, but that work takes time. And so I would say as a founder, if you're going to go into a space, you have to anchor into your why always repeatedly when you're faced with challenge like that, especially in blue ocean area and especially in health areas where it's stigmatized.
So well said and so important, like you said, that it can be challenging. But it also can be very rewarding, and the work is just really important. It's important to be talked about, and it's important to differentiate
Yeah.
why. It's why now, and like that like there's just so much that's coming out around women's health and the differences between women and men, and just the influx between like just more women in the workforce, more women doctors, like all of it is just trending upwards. And
Yeah.
so I'm just, very excited to see, what the future holds. So kind of circling back on that,
Yeah.
what what is the dream? What's the goal with Peli Health?
Yeah. Do you want to go?
I'll let you
Go,
take.
Helen.
I'll let you take it. Cool.
Yeah, so I would say Peli Health for us has always been anchored in affordability and accessibility for millions of women. So the goal for Peli Health is to be able to reach millions of women, and that can happen through a variety of different ways. Helen and I have been pursuing partnerships. We work with pelvic floor device companies. We've partnered with menopause companies. And so I really think the goal for Peli Health is to reach millions of women through collaborative efforts in a way that can transform their lives earlier and not waiting until we are at a surgical intervention or even where I was, this intense pelvic PT phase. There's things that can be done if you just had the right information sooner.
100%. And I just to add to that, I think our whole focus as well, mission is to make it accessible. and accessible no matter where you are geographically, accessible in terms of financially, accessible in terms of it's written in a relatable way that you can understand. Accessibility, I think, will be huge in terms of, our future vision of how we get this into the hands of women who need it.
Yeah, that's amazing. And I'm very excited for the future of Peli Health and what you all can accomplish. So where and how can people find you?
Sure, you can visit our website at pelihealth.com or on Instagram at Peli Health. Come and visit us, come find us. We do events. We run these things called pelvic power hours where we speak with experts, so MDs, PTs, sexual wellness, you name it, nutritionists, and it's all around pelvic health, which I bet most people do not realize those other things also have to do with pelvic health. But these are really in-depth interviews from the experts that are researching the field. We do those for free. We encourage you to sign up for those. You can listen to them anytime. Again, that goes back to affordability and accessibility, and that is something we will always adhere to, is making that education accessible.
Amazing. Well, thank you so much. I'll include all of that information in the show notes. Thank you both so much for being here today on the Ripple Effect with Ray.
Thank
Thank
you
you.
so much for having us.